Do an abdominal assessment here. So I am first going to start off with inspection. I have my patient right here, Sandy, my lab partner. So I'm going to first start with inspection. I'm going to look at contour. It looks flat and umbilicus is midline. I don't see any scars or striae. Color is appropriate for cultural background. And I'm going to inspect for any Turner sign, which is an abdominal bleed. So I don't see any signs of that, no excessive hair, and I don't see any pulsations or peristalsis. So next I'm going to auscultate for bowel sounds in all four quadrants. I'm going to be looking for bowel sounds, bruits, etc. Okay, so just listen for bowel sounds, and it is normal, active, present in all four quadrants. I'm now going to listen for bruits. Listening to the abdominal, renal, and femoral as well. Okay, so no bruits present. Now I'm going to percuss in all four quadrants, and I am listening for tympany. Okay, so it's tympanic in all four quadrants. I'm now going to percuss the liver span. So I'm going to go down the midclavicular line here, and so I'm just going to percuss for liver. Okay, so I'm going to start from up here. Okay, can you put your finger right up there? A little lower. There you go. I'm going to go from the bottom up here. Again, I'm listening for dullness. Okay, so it's about 7 centimeters at the midclavicular line, which is a normal range. Normal liver span should be between 6 and 12 centimeters. So now I'm going to percuss for the spleen, which is going to be in the mid-axillary line. Again, looking for dullness. Okay, so all I heard was tympany, so no dullness present. So the spleen and liver are not enlarged. So I'm now going to palpate. I'm going to do light palpation first, checking for any tenderness, any superficial masses, or any lesions. So I'm going to palpate lightly, going down just 1 centimeter. Any tenderness? Now I'm going to do deep palpation. Any tenderness when I do that? Again, looking for any larger masses, nodules. Okay, so none of that present. Now I'm going to palpate for McBurney's point. I'm going to ask my patient to take a deep breath while I palpate McBurney's point. Actually, this is Murphy's sign. I'm checking Murphy's sign for cholecystitis. So I'm going to have you take a deep breath here. And then I'm going to be palpating. Okay, any tenderness? Okay, so no presence of cholecystitis. Now I'm going to do McBurney's point here. So I'm just going to palpate. Any tenderness? Okay, I'm also going to do rebound tenderness at the same time. So I'm going to push down and release. Any pain when I release? Okay, so no presence of appendicitis. So now I'm going to check for costovertebral angle tenderness. I'm going to have you sit up. So I'm going to go in the back here. Any tenderness when I do that? Okay. Okay, great. And so that concludes my abdominal exam. Okay, so now we're going to do the musculoskeletal exam. So I'm going to be inspecting each joint and then also palpating it while she does the range of motion. And then I'm going to be checking for color, edema, any extra effusions, any tenderness, checking for temperature, crepitus, all of that while I'm doing each joint. So the first joint I'm gonna do is the shoulders. So I'm going to inspect the shoulders, and then I'm just gonna have you follow me. So if you can just do this called the windmill. And any pain or tenderness when you do that? Okay, so go ahead and do that again. I'm gonna check. Wait, sorry. Do the windmill? Yeah, there you go. Okay, perfect. And now I'm gonna have you do the aptly scratch test right here. So go ahead and touch your hands. Good. Now do the other side. Okay, good. And so now I'm going to test for muscle strength here. So I'm just going to have you lift up like this against my resistance. Okay, go ahead. Okay, and then do this against my resistance. Okay, good. So strength is 5 out of 5 for the shoulders. Now I'm going to do the elbows. If you could just put your arms out here and then flex, extend, and you're already on supinate, so pronate. And then kind of do the same thing. So do those same motions again. Flex, extend, supinate, pronate. Okay. Now for the wrist, I'm going to have you flex, go up, go down, go side to side, and then do that again. Up, down, side to side. And so normally I would do it again on both sides. But for test purposes, I'm just going to show you on one. But normally I would be feeling for both. And then while I am on the hand part, I'm going to be palpating again, not just the wrist, but the hands for any Herberdin's nodes, which would be on the distal end of the interphalangeal joints, and then the Bouchard's on the proximal. So, and then I'm going to test for any carpal tunnel. So I'm going to have her do Phelan sign. Go ahead and do this. I'm going to have her hold it for 60 seconds for this, and to see if she has any tenderness. And then I'm going to have her put your arms out like this. I'm going to do Tunnel sign, where I'm just going to strike the medial nerve right here for any pain. Any pain when I do that? Okay, so that's it for the wrist. So for the knees, I'm just going to have you be able to kick up both, extend. Oh yeah, there you go. Kick up, extend. Can you do this? Okay, good. So I'm just going to have you do that again. Go kick up. Okay, no crepitus there. I'm going to do the ballottement test, testing to see if there's any extra fluid in there or any effusion. So I'm just going to tap each knee. And there's no presence of any effusion or extra fluid there. So next I'm going to have her lie down and bend your knee. So I'm going to do the drawer test here, testing for any ACL, PCL tears. So first I'm going to put my hands behind, so I would normally do it on each side. I'm going to put my hands behind her knee here and just pull up and push down, kind of do this motion here. And if there's no tenderness, she's negative for any ACL or PCL tears. The ankles, I'm going to have you just flex, so point your toes up and then down. And can you kind of turn them all around here? Good job. So I'm palpating at the same time, also inspecting at the same time. So I'm going to test for strength here. Actually, I'm going to have you lie down and do this. I'll be straight up. Okay, so now point your toes towards you. Okay, now push them away. Okay, so strength again is 5 out of 5. And then I forgot earlier to test for hand strength as well. So are you able to grip my hands here? Good. Okay, so strength for her hands is also 5 out of 5. While you're still lying down, I'm going to do the hip. So let me pull this out for you. Okay, so are you able to raise your leg up? Okay, up and then go. Actually, not for the knee. We're going to do the hip. So we're going to have you lift your leg up, down, and then can you do, Actually, yeah, that's good. So we're going to do flex, extend, and then we're going to do adduct here. So go ahead and put your leg that way, and then abduct that way. So for extension, I'm going to have you roll onto your side, and then extend your leg back right here. Kick your leg back. Good. So extension is good. And then I'm going to have you just do that motion again here. Checking for any crepitus again. All the things that I mentioned in the beginning. Okay, good. And then for strength, I'm going to have you lift your leg up. Okay, so strength is 5 out of 5 there. Now I'm going to do spine. So go ahead and stand up. Sorry, that might help. Okay, so I'm going to have you bend over for me. I'm just going to check your spine here. So I see that the spine is midline. I'm also going to palpate for any step-offs. Go ahead and stand back up. Again, palpating for any step-offs. And so I don't see any there. And then for cervical spine, I'm just going to have you kind of rotate up and down. Good. Okay. So that concludes the muscular skeletal. Actually, sorry, for spine, I forgot to do one more thing here, just a test for range of motion. Can you go off to the side here? This is the lateral bend. We're going to do a rotation right here. And then she already did the flexion, so I'm going to have you do a back bend for extension. Okay, great. Now that concludes the musculoskeletal.